All right, good afternoon and welcome to the Assembly Committee on Health and Human Services. Would the Secretary please take the roll?
Assemblywoman Gonzalez. Assemblywoman Gorlow. Assemblyman Gray. Assemblyman Hafen. Assemblyman Hibbets. Assemblyman Koenig. Assemblywoman Newby. Assemblyman Wynn. Assemblyman Orentlicker. Assemblywoman Taylor. Assemblywoman Thomas. Chair Peters.
And I am here. Thank you so much, everyone, for being here on our Friday. A couple of agenda items, but first we'll go over our basic housekeeping items. Please remember to silence your electronic devices and so that we're not interrupting folks as they're presenting. Members of the public may provide testimony in a variety of ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testifying or in lieu thereof. Written public comment may be submitted before, during, or up to 24 hours after the meeting's adjournment. If you wish to testify in person, please sign in at the door and leave a card so we have a record of your name. If you do not testify, you may also wish to sign in so we have a record of your interest in the bill in the event that we'd like to reach out to you. To ensure an orderly flow of discussion, all comments, questions, and responses must go through me. Also, committee members must be recognized by me before you can speak. Additionally, I ask our presenters on Zoom video call to leave your cameras off and your microphones muted so until it's your turn to present or I direct a question to you. When testifying in person, please turn the microphone on to speak and off to listen so we can avoid the reverb. We will take public comment at the end of the agenda. With that, we'll move on to the agenda. We were going to start today with work session. We're chugging through these bills, you guys. It's great. Thank you for your effort in getting amendments into the committee in a timely manner, which really helps us in getting these things done so we can keep legal busy. Everyone has a copy of the work session documents on your desk. If you have any questions, we will take questions periodically throughout the presentation. I would ask Mr. Ashton to please begin with Assembly Bill 132.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, Legislative Council Bureau, and my usual reminder as nonpartisan staff, I can neither advocate nor oppose any measures before you today. We will start with Assembly Bill 132, as the chair said, which was heard on March 1st, and for the sake of time, I will go straight to the amendments. Assemblywoman Cohen proposes to revise the current provisions of AB 132 with the conceptual amendment and mock-up which are attached to the work session document. In summary, the amendments, number one, allow state and local agencies, institutions, or entities to conduct opioid overdose fatality reviews and authorize access to data and records necessary for such reviews. Number two, authorize the sharing of aggregate data with state and local agencies throughout the state to recommend community-level interventions or actions to prevent opioid overdose fatalities and facilitate the coordination and organization of opioid overdose fatality reviews by a statewide entity for the purpose of identifying trends and making recommendations on interventions to prevent opioid overdose fatalities. Thank you, Chair.
Thank you. Do we have any questions? Seeing none, I would entertain a motion to amend and do pass. Assemblywoman Gorlow, do I have a second? Thank you, Assemblywoman Gonzalez. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. The motion passes unanimously. We will move on to Assembly Bill 130. Oh, sorry, Cohen. Assemblywoman Cohen, please. Thank you. We will move on to Assembly Bill 135.
Thank you, Chair. For the record, Patrick Ashton, Committee Policy Analyst, Research Division, LCB. Assembly Bill 135 was heard on March 20th. It requires the Nevada Housing Crisis Response System of the Department of Health and Human Services to collaborate with the Department of Motor Vehicles to assist a person who is transient at imminent risk of homelessness or homeless with the person's application for an identification card. Assembly Bill 135 also requires an issuing entity of birth certificates to notify an applicant for a birth certificate if required documents are missing from the application. If the applicant is homeless, the issuing entity must allow the applicant at least 30 days after such notification to submit the missing documents. Finally, the bill requires Clark and Washoe counties to each develop a strategic plan addressing homelessness within their respective counties. Amendments. And members, there are two conceptual amendments which are attached to the work session document. The first one is from Clark County School District, and it amends Section 6. It removes the requirement that the date of birth must be included on a school identification card when presented as an alternative to prove the age of an applicant for an identification card who is a homeless child or youth less than 25 years of age, and requires such an applicant to additionally present an unofficial school transcript, which must include the applicant's date of birth. The second amendment submitted by Clark County proposes to remove Section 7, which requires Clark and Washoe counties to each develop a strategic plan addressing homelessness, among other provisions. Thank you, Chair.
Thank you, Mr. Ashton. Are there any questions from the committee? Seeing none, I'd entertain a motion to amend and do pass.
So moved.
Oh, discussion? Okay. No, I have a motion from Assemblywoman Thomas and a second from Assemblywoman Gonzalez. Discussion, Assemblyman Hafen.
Thank you, Madam Chair. I will be supporting this bill today. I appreciate everyone working together to ensure that everyone has the ability to get an ID. As you know, I have another bill that's been dubbed the voter ID bill that would do something very similar, and so I'm very passionate about this, and I just want to thank everyone for getting together to make this happen. So thank you.
We are always looking for ways to make it easier for folks to access social services. Are there any other discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. The motion passes unanimously. And that would go to Assemblywoman Gonzalez. Thank you. Assembly Bill 156. Oh, actually, we're going to hold that one to last because I think it has the most components to it, because we have a couple of extra amendments on that one, y'all. So we're gonna skip 156 and put that at the bottom of the agenda for work session. We're gonna jump to Assembly Bill 197.
For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 197, heard on March 20th, authorizes by regulation of the Division of Healthcare Financing and Policy of the Department of Health and Human Services the imposition of an assessment on specific healthcare provider groups and physicians in specialty areas to increase Medicaid reimbursement rates of providers in the assessed group. At least 67% of the affected providers must approve the assessment, and the assessment must be in an amount equal to a percentage of the net revenue generated by the healthcare provider from providing care during a calendar or fiscal year. The division may use the assessment proceeds to increase Medicaid reimbursement rates of providers in the assessed group and to cover any administrative costs. If the legislature authorizes the use of funds for any other purpose, the division shall poll each provider group against which an assessment is currently being imposed concerning the continued imposition of the assessment. If the poll does not receive an affirmative vote from at least 67% of the affected providers, the assessment ceases and all pertaining regulations are voided. Amendments. Vice Chair Orndlicker proposes the following amendments to Section 5 concerning the definition of a provider group. Number 1, revise to exclude hospitals, physicians, and physician services. Number 2, revise to include items or services listed in certain sections of the Code of Federal Regulations to include any other class of healthcare providers who might become eligible under federal law for provider assessment. And number 3, clarify that a provider group may have multiple specialties within a group and ensure that any future provider group with multiple specialties is also within the purview of this bill. Thank you, Chair.
Thank you, Mr. Ashton. Are there questions on Assembly Bill 197? Seeing none, I would entertain a motion to amend and do pass.
So moved.
Thank you. I have a motion from Assemblywoman Nguyen and a second from Assemblywoman Gonzalez. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. Raise your hands, please. We have a nay from Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray. The motion passes. I will assign that to Assemblyman Ornlicker.
Thank you, Chair.
Thank you. On to Assembly Bill 237. Mr. Ashton.
For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 237 was heard on April 5th, and for the sake of time, I will go straight to the amendments. Chair Peters proposes to replace all sections of the bill with the attached conceptual amendment attached to the work session document as presented at the bill hearing 2 days ago. Thank you, Chair.
Thank you, Mr. Ashton. Is there any question from committee? Are there any questions from committee? Seeing none, I would entertain a motion to amend and do pass. Thank you. Assemblyman Nguyen, second from? Oh, thank you. Assemblywoman Gorlow, I think, got the first one in there. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? And raise your hands, please. Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray. Motion passes. I would assign that to myself. Mr. Ashton, we can move on to Assembly Bill 259.
Thank you. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 259 was heard on March 22nd, and for the sake of time, I will also go straight ahead to the amendments. Assemblywoman Brown-May proposes the amendments set forth in the mock-up attached to the work session document. In summary, the amendments, number 1, replace throughout the bill any references to a provider of jobs and day training services with the intent to encompass all providers of jobs and day training services who are authorized to employ or arrange for the employment of a person at less than minimum wage. Number 2, remove subsection 2b through E in section 3, which are several report requirements accompanying the transition plan. Number 3, delete subsection 4 of section 3, requiring the division to compile submitted data and make it available to the public on an internet website of the division. Number 4, revise in section 8 the date to January 1st, 2025. Number 5, revise in section 11 the existing Nevada Medicaid home and community-based services for intellectual disabilities and related conditions by requiring Medicaid to apply for a waiver to the requirement that a person receiving pre-vocational services be compensated at less than 50% of the minimum wage, and revise the effective date in section 15. Thank you, Chair.
Thank you, Mr. Ashton. Are there any questions? Assemblyman Hafen.
Thank you, Madam Chair. I just want to confirm that the intention of the amendment, or at least portion of the amendment, is to either eliminate the fiscal note or substantially reduce it.
I don't believe that Assemblywoman Brown-May is in the room today. And as we're not a money committee, we don't generally assess the fiscal notes. But I don't know if Aging and Disability Service, that it's okay. I would ask you to get that from the Assemblywoman.
Thank you, Madam Chair. Then I will support the bill until I'm able to get the answer to that question, but I will have to reserve my rights, so thank you.
I appreciate that. And you'll have an opportunity, I think, when it gets pulled into ways. Are there any other questions? Assemblyman Gray.
Sorry, Madam Chair. Yeah, I'm going to be in the same boat as Assemblyman Hafen.
Thank you. I think those were supposed to go under discussion because I haven't taken a motion yet, have I? That's okay. I would entertain a motion to amend and do pass from Assemblyman Nguyen and a second from Assemblywoman Taylor. Is there any discussion outside of those made in question? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. Motion passes unanimously. And I would assign that to Assemblywoman Brown-May. Assembly Bill 293.
Thank you, Chair. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 293 was heard on March 20th. It requires the Director of the Department of Health and Human Services to cover supports and services provided to Medicaid recipients through medical legal partnerships that are aimed at addressing social determinants of health. Amendments. Committee members, there's a technical amendment to AB 293, which was submitted after the work session document was finalized. And Chair, Mr. Robbins or Vice Chair Orndlicker could summarize it for you. Thank you.
Mr. Robbins.
Yes, Eric Robbins, LCB Legal for the record. So in subsection 2 of section 1, it says the department may apply to the Secretary of Health and Human Services for any waiver granted pursuant to federal law or amendment to the state plan for Medicaid that authorizes the department to receive federal funding to include in the state plan for Medicaid the coverage described in subsection 1. So the amendment would be to replace the second reference to the state plan for Medicaid with a more general reference to the Medicaid program, because if the service is provided pursuant to a waiver, which is the first option granted by that subsection, then the coverage would not be included in the state plan itself, but would be in a separate waiver document.
Thank you. Are there any questions? Seeing none, I would entertain a motion to amend with the amendment described by Mr. Robbins and do pass. Assemblywoman Thomas and a second from Assemblywoman Gonzalez. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Raise your hands, please. Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray are nays. The motion passes, and I would assign that to Assemblyman Ornlicker.
Thank you, Chair.
Thank you. And we will move to Assembly Bill 422.
Thank you, Chair. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 422 was heard on April 5th, and I will go straight to the amendments. Assemblywoman Gorlow proposes to replace the current provisions of this bill and instead authorizes the Aging and Disability Services Division, DHHS, to initiate a pilot program through the Autism Treatment Assistance Program. The purpose of the program is to provide evidence-based services and supports for children diagnosed with fetal alcohol spectrum disorders that would lend to the development of a service delivery model and program to address the unmet needs and service gaps. The pilot program is based on available funding and ends no later than December 31st, 2025. Thank you, Chair.
Thank you. Are there any questions? Seeing none, I would entertain a motion to amend and do pass Assembly Bill 422 from Assemblyman Wynn and a second from Assemblywoman Taylor. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Raise your hands. Assemblyman Hafen and Assemblyman Gray are nays. The motion passes. All right, we'll move back to Assembly Bill, I would assign that floor statement to Assemblywoman Gorlow. We'll move back to Assembly Bill 156.
Thank you, Chair. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 156 was heard on March 15th, and it requires, it requires certain healthcare providers, upon diagnosing a patient with an opioid use disorder, to counsel and provide information to the patient concerning evidence-based treatment for opioid use disorder. If the patient requests medication-assisted treatment, a provider who is authorized to prescribe such treatment shall offer to issue such a prescription. All other providers shall refer the patient to a provider who is authorized to issue such a prescription. Finally, AB 156 requires certain publicly funded providers or programs for the treatment of alcohol or other substance use disorders to prioritize the treatment of persons according to federal regulations. Amendments. There are two conceptual amendments attached to the work session document. Chair Peters proposes the first conceptual amendment. In summary, the amendments remove any provisions that require prison or jail to ensure the availability and continuation of medication-assisted treatment for an incarcerated individual diagnosed with an opioid use disorder. And number 2, require the Department of Corrections and local jurisdictions that maintain a jail to each conduct a study on the provision of medication-assisted treatment in these facilities and present and report each study's findings to certain interim committees by June 30th, 2024. The study requirements are outlined in the conceptual amendment. The difference to the conceptual amendment as presented during the bill hearing is item 2B on the bill page, which requires local jurisdictions within a county whose population is 100,000 or more to additionally study the feasibility to establish a medication-assisted treatment program that meets certain standards and assesses community partnerships with various behavioral health care providers. Any local jurisdiction within a county whose population is 100,000 or less is authorized but not required to study these additional items. The second set of conceptual amendments in the work session document is from Vice Chair Orndlicker. In summary, the amendments require a practitioner who prescribes or dispenses an opioid to a patient for the treatment of pain to counsel and provide information to the patient concerning the possibility of opioid overdose and treatment of an opioid overdose through an FDA-approved opioid antagonist, requires the State Board of Pharmacy to prescribe a protocol, requires a pharmacist to register with the State Board of Pharmacy, and requires public and private health insurance plans to reimburse pharmacists for these services at a rate equal to similar services provided by physicians, physician assistants, or advanced practice registered nurses. Committee members. Vice Chair Orndlicker is proposing an additional amendment to AB 156, which was submitted after this work session document was finalized. You should have received a copy of this third conceptual amendment, and it is by now also available on Nellis. In summary, the amendment, number 1, establishes an account for the bulk purchasing of opioid antagonists, which may receive funding from gifts, grants, and donations, proceeds of opioid settlements, and appropriations from the legislature. The account is administered by the Division of Public and Behavioral Health, DHHS, and funds in the account do not revert to the State General Fund. Number 2, authorize the division to bulk purchase opioid reversal medication using funds from the opioid reversal medication bulk purchase account. And number 3, authorize the division to distribute opioid antagonists purchased from the account to public health organizations or other entities at the discretion of the division. Thank you, Chair.
Thank you, Mr. Ashton. Are there any questions on any of the amendments? Seeing none, I would entertain a motion to amend and do pass. I have a motion from Assemblywoman Gorlow and a second from Assemblywoman Newby. Yep. Yes. Okay, thank you. Is there any discussion on the motion? I see Assemblyman Ornlicker and Hafen.
Thank you, Chair. I'd just like to thank some of the people who helped me with these conceptual amendments, Dr. Tracy Green at Brandeis, Jason Griffin, and Jimmy Lau and Brian Reeder with this bulk purchasing proposal.
Thank you. Assemblyman Hafen.
Thank you, Madam Chair. I'm going to support this today. There are sections in the amendments that I really do appreciate all the hard work in. There's some sections that I'm still trying to digest, but I believe that the overall concept is good, so thank you.
Thank you. I do too, and I do want to also echo the thanks to the law enforcement groups that I met with who were interested in pursuing something around this area, but just acknowledging that the resources are not quite there yet for us to get all the way to where we'd like to be yet. So we will hopefully have a plan next time. Any other discussion? All those in favor, please signify by saying aye. Aye. Any opposed, nay. The motion passes unanimously. Thank you all. I would assign that to Assemblyman Ornlicker.
Thank you, Chair.
Thank you. All right. Great, we're just chugging along. Okay, so we're going to close out the agenda item for work session and go into bill hearings. We have 2 bill hearings today. I'm going to, let's see, I can't remember what order they're in on there. We're going to take them in order. They're very close numbers. We will start with the bill hearing on Assembly Bill 348, which creates the virtual Early Childhood Family Engagement Pilot Program in the Department of Health and Human Services. Welcome, Assemblywoman Torres. It's exciting to have you in here for the first time this session. Please remember to state your name for the record when you speak. You may begin when you're ready.
Thank you. Good afternoon. I'm Assemblywoman Solana Torres for the record. And thank you, Chair Peters and committee members. This is actually the first time I have ever presented a bill in HHS, but don't worry, you'll see me again soon on Monday. I proudly represent Assembly District 3 in the heart of Las Vegas, Nevada, and thank you for the opportunity to present this bill, which seeks to expand early childhood education opportunities for all Nevadans by appropriating funds for a virtual early childhood family engagement pilot program within the Department of Health and Human Services. As multiple academic research continues to highlight, the earlier we can invest in families and a child's education journey, the drastically improved social and economic outcomes we see for our students are. Children who have an early childhood education are more likely to earn a high school degree. They're more likely to pursue a path towards post-secondary education. And overall, early childhood education is a key tool to improving student achievement through the duration of their K-12 journey. As an educator, I've seen that firsthand. Even in high school, you can tell which students had access to early childhood education services. Today, we are here to vastly expand the accessibility and reach out of early childhood programs by funding a virtual program through the Department of Health and Human Services to help target the communities with continued challenges to obtaining any form of early childhood education, working class families, children within the foster care system, and folks in our rural and frontier communities. I have with me here today Dr. Claudia Martiner, the Executive Director and co-founder of Waterford Upstart, who has been a strong provider in this area to tangible access to early childhood education, which impacts young Nevadans' lives. Before I hand it off to her to present, I will briefly walk through the different sections of the bill as amended. Section 1 of the bill makes conforming changes, while Section 2 and 3 defines department and program for the bill. Section 4 creates the virtual early childhood family engagement pilot program within the Department of Health and Human Services and outlines the program's core purpose. Section 5 outlines the request for proposals process the department must issue to select an organization to lead this work. Section 6 of this bill outlines the program's administration and requirements for both the populations and standards the program must adhere to. Section 7 relates to the reporting requirements the selected 501c3 must transmit to the Department of Health and Human Services at the conclusion of each fiscal year. Section 8 details the appropriation amount over the biennium to the pilot program, and Section 9 states the bill's effective date of July 1st, 2023. Just a couple reminders for the committee too. Obviously, there will be a conversation about the fiscal note, but that is not a conversation for this committee. That's a conversation for the Finance Committee, and a conversation that I hope to have after the bill has been moved out of this committee. The conversation here today is around really expanding the access to early childhood education programs within our community. With that, I will go ahead and pass it to Dr. Claudia Miner.
Let's turn on the...
Thank you. Claudia Miner for the record. Good afternoon, Chair Peters and members of the Assembly Health and Human Services Committee. My name is Claudia Miner, and I'm here today to provide information on the nonprofit Waterford Upstart, which is an example of the programs that exist that can accomplish the goals outlined in Assembly Bill 348. I'd like to reference this document, which was uploaded onto Nellis for the committee and members of the public. Most educators agree that the most strategic time for a child to start learning is early. When young children don't have learning opportunities, they start school without basic skills. And when that happens, they're 25% more likely to drop out, 40% more likely to become teen parents, and 60% less likely to attend college. But access to early education is a national problem in the United States. Despite outstanding efforts by Head Start, LEAs, and quality site-based preschools, there are still 2.2 million children in the U.S. without access to early education. That's more than half of the 4-year-olds in the country. There are significant barriers to overcome to serve our youngest learners, including geography, especially in rural parts of the country, and transportation, because most early education doesn't provide transportation. Instead, it relies on parents, many of whom are working. And then there is the important issue of parent choice. No state requires a 4-year-old to go to school. So it is up to parents to find a solution that works for them if they're going to access early education for their children. In places like Nevada, parents who work shift are especially challenged. With all of this in mind, 15 years ago, I co-founded the Waterford Upstart program. We began in Utah, where the state faced significant rural service challenges, and many parents wanted to keep their children at home to prepare them for school. Waterford Upstart is a tech-delivered kindergarten readiness program that can be done in the home. It uses early learning software that individualizes instruction so children can learn at their own pace. We've relied on experts on the science of reading, brain development, and all aspects of early learning to tell us what the software should do and look like. But there's another piece to Upstart that makes it different and more effective. Upstart puts parents in control of their children's education. We believe that with the right kind of support, including computers and internet if the family doesn't have them, parents can get their children ready for school. This fits with the research that suggests parents are their children's first teachers, but we don't ask them to do it alone. We provide every family with a coach that speaks the home language, and we also provide a steady stream of resources. So simply stated, that's what Upstart is. Children use the software 15 minutes a day, 5 days a week, and Waterford Upstart supports the parents through training, phone calls, text, emails, and offline materials. To date, we've had more than 200,000 children use the program, and our results have been outstanding. An external evaluator has shown that our children have 2 to 3 times the learning gains the year before school compared to children who don't participate. Several random control trials showed Upstart has strong evidence of effectiveness, and a longitudinal study showed that our gains last into 3rd and 4th grade, the highest grade Upstart children had achieved. These are academic gains. But there's another study that showed our children's social and life skill gains were as great as those attending public and private preschool. But the best part is, when we ask parents if they feel they will be more involved in their child's education after Upstart, 98% say yes. To date, the program has been piloted in all 50 states, and 11 states currently are investing state funding to provide it to their children. Now, there are skeptics. Some people don't believe young children should have screen time. And to them, we say the usage requirement for Upstart, just 15 minutes a day, is far below the hour recommended by the American Pediatrics Association for 4-year-olds. Some people only believe site-based preschools can work. And to them, we say site-based preschool is great. But if you can't get all the children there, or you can't find teachers or build classrooms, parents won't send them to school, isn't an evidence-based virtual option a great alternative? At Upstart, we do not want to replace anything. We want to serve children who otherwise would not be getting early education. And we estimate that about 86% of Nevada 4-year-olds are not getting early education. We hope you will consider adding a program like the one described in AB 348 to a mixed delivery system in Nevada to get all children ready for success in school. I thank Assemblywoman Torres for bringing this bill forward and appreciate your interest in time. I stand ready to answer any questions you may have about the program.
And Assemblywoman Torres, for the record, just one last comment too. I just want to note that Waterford Upstart is only one great program that is already providing serving students here in the state of Nevada. This bill does not appropriate the funds directly to this organization, but rather it would appropriate the funds to DHHS, which would then begin the RFP process. And so this is the kind of program that we might see applying for this type of RFP.
Thank you for the presentation. We have several questions. I want to thank the sponsor, though, for speaking with me yesterday about the allocation ask, the appropriation ask, and I'm pleased to have the conversation of what we should be spending in pre-K. Right, a lot of the complaints and the opposition that I've read has to do with how much we are already spending in this space and how this ask is greater than what we spend in total in some of these other programs that exist today. But I think that that's such an important piece to talk about. Why are we funding things in such a little way that the pie gets smaller for everybody? And how is that just for our children? So that's a conversation to be had in a different committee that's not really policy related, but more fiscal appropriation related. But I wanted to extend my appreciation to those who have brought that to the attention of our body. I have a couple of questions. I'm going to start with Assemblyman Hafen.
Thank you, Madam Chair. And thank you for the presentation, Assemblywoman Torres. I'm just kind of curious, how much would this cost per kid for the Waterfront Upstart to provide this program? And also, how many kids would you be able to serve with the appropriation as requested?
For the record, Claudia Minor, through Chair Peters, to Assemblyman Hafen.
Please feel free to go directly to the member.
Thank you. We've modeled and we estimate that 30% of children would need computers, or families would need computers. About 25% would need internet. The program itself costs $1,100 per child, so with those figures in mind, we could serve 2,860 children per year.
Thank you. I have Assemblywoman Thomas next.
Good afternoon, and thank you, Madam Chair. And thank you, Assemblywoman Torres, for the presentation. And just a quick question. I believe in early childhood. Matter of fact, I think that that's one of the things that, one of the reasons why I'm an Assemblywoman right now, because of pre-K. Two questions. One is, what age are you looking at when you start this program? And the other one is, I feel like we should be tracking every pre-K student. And I was just wondering, have you engaged with the early childhood department of education? Sorry.
For the record, Claudia Minor, thank you for that question, Assemblywoman Thomas. The year before kindergarten, and we understand that that would, for the most part, they're 4-year-olds, some would be 5 when they begin the program, if that answers that question. And tracking the children is very important so that we can see the results over time from the program. So we'd be happy to work with whatever we can provide. For example, we can provide information to the department so they can assign whatever identifier they use, and that's usually the way we've seen other states prefer to do it rather than to give us a number.
Assemblyman Slater, sorry for the record, and just to add on to that, so Section 7 of the bill on page 3, it does require that there is reporting too. So there would be a report to the department, which includes the number of children enrolled in the program, the number of percent of children that meet the criterion identified earlier in the bill, the demographics of the children, and then the quantitative data to the extent available that demonstrate the effectiveness of the program. So there definitely is a requirement that that data is reported to the department.
Thank you, Assemblywoman, because it's very necessary. Right now, we're only tracking about 2,300 children in our entire state. That's why I think it's very important for us to have that tracking, so I'm glad you have that in this bill. Thank you so much.
Thank you. That's a good point. Assemblyman Hibbets.
Thank you, Madam Chair. Either I'm psychic or I've heard this exact same presentation in a previous committee hearing, either here or in the happiest committee in the Assembly of Government Affairs. Thank you, ma'am. Why are we hearing the same presentation twice in two different bills is my question.
Assemblyman Salinas Torres for the record. So we did probably hear a very similar conversation in the phenomenal Committee on Government Affairs. I think it was actually AB 113, if I remember the number correctly. That was Assemblyman Thomas's piece of legislation, and that bill creates the Office of Early Childhood Education that would be under the governor's office. This is different. This is appropriating funding to the Department of Health and Human Services to carry out the duties of a very specific program, whereas that bill had to do more specifically with ensuring that we are looking at early childhood education and making sure that we're consolidating, coordinating those early childhood education efforts.
Thank you for the clarification. Thank you, Chair.
Thank you. Assemblywoman Taylor.
Thank you, Madam Chair, and thank you to our colleague and leader of the most efficient committee in the state legislature, and thank you, Doctor, for being here. Just a couple things. One is, as the educator that I am, there's no replacement for that early childhood education. We look so much and we want our children to graduate college and career ready. And I know you gave some college numbers, but this is equally as important for those children that don't go to college, that are going into their careers and so on, to get that right, to get the right foundation on that. So thank you for bringing the bill, and thank you for the program, because it sounds like it's helping a lot of students. Hopefully it will be able to help more. My question, because it is such a great program, it really does sound like it, and I'm excited for those children that don't go to pre-K, and that's usually our lower income, most vulnerable children, our Black, brown, and poor kids that usually are the ones that miss out on pre-K, so they already start behind. How do we get this information to them, to those families? I know once you get them, they can get connectivity, they can get a laptop, which I think is wonderful. But what about those families that don't tune into the usual communication? How do we get those families that really need it?
And as Assemblyman Salinas Torres for the record, I'm going to let Dr. Minor answer this, but I just want to say, like, preface this conversation with, this is a conversation now that I've had with Dr. Minor for more than 2 years. So I think it started probably about 3 to 4 years ago. We brought a bill last cycle that it didn't get scheduled for a hearing. It kind of missed the deadlines, but we're bringing it back, this legislation. The reason I agreed to initially carry this piece of legislation was because of the work that Waterford had already started doing in our most vulnerable populations in the state of Nevada. So that's one of the reasons that I agreed to carry it, because that was exactly my question. And so I think Dr. Minor can talk about some of the work that Waterford Upstart has already done from the funding that they do have to impact Nevada families.
For the record, Claudia Minor, and thank you for that question. Outreach is incredibly important to us, and we do it in a number of ways. One of the easiest ways today is use social media, but you are exactly right, Assemblywoman. Not everyone has access for the tools. So we are on the ground meeting with the families, but we like to do that best through trusted gatekeepers. In other words, they don't know us. So we will find a partner in the community, and we will convince them of the value of the program, and then ask them to introduce us to their families, where it then becomes up to us to convince the families to participate. We do that from state fairs to free lunch in the park. You name it, we're there. But we also use, and this is very important in rural areas, we use a lot of radio, for example. We use television, of course, and we use dual language television. So that's important for finding those families as well. Our recruiters do speak Spanish, for example, and they represent all of the communities that we want to reach. So I hope that answers your question.
It does, Dr. Minor, and thank you, Chair, for allowing the follow-up. I'm glad you mentioned, just as you did, because I had a constituent that asked, is this program just for students, just for the kiddos of color? Is it just for Black and brown kids, so to speak? Because when I think about it, I do think about the rules as well, because it's a virtual program. This allows those indigenous families that are, maybe living in reservations and so on. I think about that. So for the record, can you clarify that? Is this just for Black and brown kids?
For the record, Claudia Minor, and no, it is not. One of our most important populations we have served across the country is rural children. And that's pretty simple. We know that their older siblings can get on a bus and go to school, but it's really hard with a 4-year-old to put them on that kind of travel schedule. So rural has worked very well for us. In fact, we have a Department of Education EIR grant, which has given us great results in the 5 Great Plains states, where the population per square mile averages less than 1.
And Assemblyman Torres, for the record, so in this piece of legislation too, in section 6 of the bill, sub 2, it does outline exactly like what students would be served too. So this would be children who are 4 years old, 4 years of age at the beginning of the school year, including without limitation those who have an income that is, I think actually, did I fix that? No. 1 moment.
It's supposed to be 200%, right?
Yeah, and that may actually need a slight change because it reads has an income which is not more than 200%, but I think, yeah, actually, yeah.
Yes.
Yeah, that's correct.
That's correct.
Okay, thank you. I always get confused with those not mores. So not more than 200% of the federally designated poverty line, and then also students in the foster care system and students in rural areas, which, and these are the students that I think are probably the students that need access to a program like this most, who have difficulty having access to a pre-K in their community. There's oftentimes just not enough pre-K seats, especially in our rural Nevada, but then also in our more urban, condensed areas where there's many people that, are at that poverty line, and just there's not enough seats there.
Thank you both so much. I appreciate it. Chair, thank you for your indulgence.
Thank you for asking those important questions. And I want to note that housing this program under DHHS means that they can integrate it into their no wrong door policies, right? So as families are being assessed for other social services, including Medicaid, that this can be another service that gets connected to families who need it through those programs, which I think is beneficial for it being housed through DHHS. I have Assemblyman Gray next.
Thank you, Madam Chair. And thank you guys for clarifying that. My district, it's, I lovingly refer to it as it's got the richest area in the state, and it's got the poorest area in the state. And I can tell you that poverty knows no skin color, and kids need these skills. If we can spend money anywhere in education, I feel where it's going to have the greatest impact for return on our investment, it's going to be pre-K. And this is there. And I'm not making a statement on the cost of the program or anything. I just think this is probably where we are going to get the biggest bang for our buck, giving these kids a foundation to move forward on. If they get to kindergarten and they don't have the basic skills to read, and at least write their name, they're going to be lost from day one, because that's where most kids are entering the kindergarten arena these days. So thank you guys, and I look forward to see what comes of any amendments. And that was a long way of saying I don't have a question.
I'm sorry, we have a question on the amendment, and its relation to section 4B. I'm gonna pull that up real quick. Can I use your screen? Sorry. Okay, so in section 4B, in your amendment, you have an added sentence in here, and we want to clarify whether that was intended to be the purpose of the program, to be under the purpose of the program, or whether it's a scope of work within the context of the program. And that is the twice during the program year and as requested by participating families, provide via email and in writing information. Yeah. And we can work with you on maybe moving that around if we need to, but just wanting to know if that was intended to be in the purpose of the program, or if that says maybe a scope of work of the program.
For the record, Claudia Minor, I would think would be scope of work, and I would say that since we have access to these families and a coach, something we'd be happy to do to tell them about other services available to them from the state.
Thank you. Assemblyman Torres, for the record, yeah, I see exactly why you're noting that too, because it's probably more appropriate in a different section of the bill as well. So I as long as like that, something along those language, but that is the intent, obviously, to make this a part of that scope of work.
Yeah, okay, we can continue working on that. We just wanted some clarification. on the amendment. And I know amendments are moving very quickly right now, so I appreciate the dexterity around those. Are there any other questions before we move into testimony? All right, we're going to move into, Assemblyman Ornlicker.
Yeah, thank you, Chair, and thank you for bringing this bill. I'm a big fan of pre-K. And I see the request for proposals. I'm glad that you have to be not-for-profit, that we're not opening up for-profit organizations. I'm curious, it doesn't, though, suggest that a school district could offer one of these programs. Is that your intention, to exclude school systems from developing these kinds of programs?
Assemblyman Signatories, for the record, I mean, to my knowledge and sitting on the education committee, school districts are very overwhelmed with the work that they have to do right now. And while they do provide some pre-K, I do not believe that it is the intent to allow for school districts to apply for these programs. I don't think that they have the tools to create virtual learning opportunities for early childhood education. As an educator myself who watched my colleagues that teach pre-K teach virtually, I think that my colleagues would agree that it's just not within the scope of work within the school district setting. I think it would also require them to create entire, systems and programs and a lot more programming maybe than it's not intended to be like a 15-minute program like, okay, everybody log into your computer at 8 a.m. That's not the intent either. It's supposed to be a little bit more individually paced.
Thank you. Any other questions? All right, seeing none, we'll move into testimony. Thank you so much for the presentation. We will take support testimony first here in Carson City, and then we'll move to Las Vegas and the phones. Is there anybody who would like to provide support testimony on Assembly Bill 348 in Carson City? Seeing none, is there anyone in Las Vegas? Seeing none. BPS, is there anyone on the public line for support testimony on Assembly Bill 348?
To testify in support of Assembly Bill 348, please press *9 now or raise your hand in Zoom to take your place in the queue. Caller, you may begin.
Good afternoon. My name is Guy Gerardin. I'm calling from Las Vegas. For a little bit of a different perspective, there's been a lot of discussion lately about health equity. And I think that what we need to recognize is that education is a fundamental social determinant of health. In terms of need, programs that close the gap in educational outcomes between low income or racial and ethnic minority populations and higher income or majority populations are truly needed to promote health equity. That said, for this program to have the greatest impact on health equity, it's imperative to reach families and marginalized communities. It's further important that the program addresses the many barriers to access faced by under-resourced families. These may include awareness, trust, language and literacy challenges, finances, the digital divide, and others. And speaking to an earlier question, this will definitely require an organization such as Waterford Upstart with a diverse, culturally and conventionally responsive outreach, established partnerships with trusted community advisors, and a proven record of direct street-level engagement. Clearly, this investment will ultimately lead to the growth and prosperities of our families and communities in general. Thank you.
Thank you for your testimony. Next caller, please.
Hello, Chair, Vice Chair, members of the Assembly Committee on Health and Human Services. My name is Gil Lopez with the Charter School Association of Nevada, which represents over 67,000 students in our public charter system, making ourselves the public charter the second largest K-12 education system. We are here in full support of AB 348. This bill recognizes the importance of childhood education as a foundation for future academic success. Our complete remarks are online. We want to thank the Assemblywoman Torres for bringing this bill forward, and we urge you to support AB 348. Thank you.
Thank you for your testimony. Next caller, please.
Chair, there are no other callers to testify in support at this time.
Thank you so much. We'll go ahead and move into opposition testimony. Is there anyone in Carson City or Las Vegas who'd like to provide opposition testimony on Assembly Bill 348? Hello.
Hi, it's good to see you. Good afternoon, Madam Chair, members of the committee. My name is Holly Wellborn. I'm the Executive Director of the Children's Advocacy Alliance. Testifying in opposition today, we've done some background work on this bill. We appreciate the sponsor for meeting with us. We appreciate the proponents of this bill for meeting with us, but we do, for a number of reasons, need to stand in opposition today. Specifically because those in-person programs are so crucial to future development of a child, to building those connections, to building that development between that in-person learning. We understand the challenges in rural communities, but investments in those in-person programs would be better spent. We do appreciate the sponsor for considering changes that connect young people to in-person programs that, after 2 years, it would be reevaluated to connect to perhaps programs that are growing in specific communities that are in person and provide that crucial learning. But for those reasons, we understand that this is a policy committee, but at some point, the very large investment that will be made that is it's the same investment as we have in our current pre-K programs, that becomes a policy decision that the legislature is making. So for those reasons, we're opposed today. Thank you.
Thank you for your testimony. It is not in the purview of our committee to make appropriations. We don't do that here. And so I appreciate your comments, but this committee has no real say in appropriations. There's a different house, or a different committee for that. Any other opposition testimony in Carson City or Las Vegas? Seeing none. BPS, is there anyone on the phone lines for opposition testimony on Assembly Bill 348?
To testify in opposition to Assembly Bill 348, please press *9 now to take your place in the queue. Caller with the last 3 digits, 629, you may begin.
Thank you. For the record, my name is Denise Tanada, and I've had the honor of working in the state of Nevada on early childhood issues as well as other issues impacting children and families for the past 25 years. In that time, I've worked extensively with a broad range of key stakeholders in the field of early childhood education and development. But I am reaching out today to express my opposition to Assembly Bill 348. And while I appreciate the efforts of the bill sponsor and the bill's proponents to increase access to early education programs and enhance family engagement, I have several concerns regarding the proposal. First, I do want to note that the Legislative Council's digest of the bill in the first sentence makes reference to the Nevada Early Childhood Advisory Council. As an appointed member of the council and also as the chair of the Nevada Early Childhood Advisory Council, I just want to make it clear that the Nevada Early Childhood Advisory Council had no knowledge or involvement in the development of this bill. We weren't asked to provide any input on the provisions in this bill. And as written, we cannot support or recommend the use of online or screen technology for early childhood education programs. Also wanted to point out, as was previously stated, that a foundational component of high-quality early learning is relational interactions, which this program would not provide. And we do align with the statement from the National Association for the Education of Young Children that was put out in March of 2022 called Making Connections. And I have submitted my testimony online, and there's a link to that article. And I also wanted to point out and reiterate that, before, and I recognize that this is not a money committee, but we're talking about funding a new program. And before we start funding yet another pilot program that's going to serve a fraction of our children. I think it's really important that we look at existing programs and how those are supported, trying to scale those up so that we are serving more children. The Nevada Ready Pre-K program has been mentioned, but our current investment is minimal in that program. We're serving, less than 16% of eligible 4-year-olds in all pre-K programs. That is not because of lack of need, it's because of the lack of investment and funding of those programs. We also have Head Start programs in the state, early Head Start programs. We rely solely on federal resources to support those, and they're serving only a fraction of eligible children. Similarly, with our child care subsidy program, which is making current efforts to make high quality early programs more accessible, particularly in underserved communities. With that subsidy program, we're serving less than 6% of eligible children. Programs like home visiting, which again, we're only using federal resources, we're serving less than 1% of eligible families, which is the lowest rate in the entire country. And we do have other projects. We do have other programs. I think before we start investing in new programs, we should try and scale up the programs to serve more children with the programs that we know that work. So thank you for the opportunity to testify.
Thank you for your testimony. Next caller, please.
Good afternoon. My name is John Craig, and I'm the Executive Director for the Nevada Association for the Education of Young Children. The Nevada Association for the Education of Young Children opposes AB 348. This bill does propose to use $8 million to create a virtual program to assist families with preparing their young children for school. This is a lot of money for a pilot program, particularly when there are other virtual options that already exist at no cost. And on December 15th, the Interim Finance Committee approved already $2 million for a virtual pre-K early learning program with similar requirements and outcomes. The Nevada Association for the Education of Young Children supports directing funds towards our Nevada State Pre-K program, which provides 4-year-olds with developmentally appropriate early childhood educational opportunities, social emotional skills needed to succeed in school, and family engagement activities. If the committee is interested in expanding access to early childhood, then we encourage you to consider universal pre-K. Thank you and have a great day.
Thank you for your testimony. Next caller, please.
If you have recently joined and would like to testify in opposition to Assembly Bill 348, please press star 9 now to take your place in the queue. Chair, there are no other callers to testify in opposition at this time.
Thank you. We'll go ahead and move into neutral testimony here in Carson City and Las Vegas. If you are here for neutral testimony, please come to the desks. Seeing none, we'll move to the phones. BPS, is there anyone on the line for neutral testimony on Assembly Bill 348?
To testify in neutral for Assembly Bill 348, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in neutral at this time.
Thank you. I'd invite the bill sponsor for closing remarks.
Thank you, Assemblyman Selena Torres, for the record, and thank you to the Committee on Health and Human Services for allowing me to present AB 348. Ultimately, we need to expand access to early childhood education programs throughout the state. And you'll notice that in my language today, I was very intentional. I didn't use the word pre-K because this isn't pre-K. This isn't a program that's going to replace in-person pre-K. My niece is in pre-K right now, and she goes to school every single day from 8 in the morning until about 2 in the afternoon. She has nap time and lunch, and she plays outside with her friends. My niece is one of only a couple thousand students in the state of Nevada who are lucky enough to get a spot in pre-K. I think every child deserves access to early childhood education programs, and this is a part of that fix. This is a part of that education. This isn't replacing it. Additionally, one of the things that I think is critical is that there is a conversation with families in that, because I think that that's one of the goals of pre-K 2 is bringing families into that education process. And this bill ensures that those programs continue to do that they're engaging with families, that they're having conversations with families about how you can support your child. My mom always tells us that my brother was in Head Start when we were kids, and that she learned a lot of her parenting skills from Head Start because of the work that those educators do with the parents. And I think, a program like this is going to make sure that those parents have the skills that they need so that they can be successful in advocating for their child's in education settings. Obviously, Children's Advocacy Alliance came up here in opposition, and I'm a little disappointed because when we spoke, I accepted the amendment that had to do with the policy. I didn't accept the fiscal appropriation amendment because I think that we're having today a conversation around policy. So I do want it noted for the record that I did accept part of that amendment. Additionally, I don't think that this is. I think that, in closing remarks, in one of the callers' comments, they noted that we need to work with a program that works. We know early childhood education works. We know that programs like Waterford Upstart work, and there's other programs similar to it. I'm not saying that this will be better than pre-K. Ultimately, one day I hope that we can that we can have universal pre-K. But I'll tell you this, we already know that today is not that day. At the end of the day, I would like to go back to my constituency and say that we did expand those educational opportunities and that we did expand access to those educational opportunities, because otherwise, when we go back, as many seats as we have right now are the ones that our constituents are going to have available to them. And in our most vulnerable communities, that means that access is significantly lower. And so I urge you to support AB 348. Thank you.
Thank you, and thank you for being here today. All right, we'll go ahead and close the hearing on Assembly Bill 348 and open the hearing on Assembly Bill 358 while we do a little bit of musical chairs. Welcome, Assemblyman. Please remember to state your name for the record. When you begin, you may proceed.
Thank you, Madam Chair. Ken Gray for the record, Assemblyman, Assembly District 39. Good afternoon, Chair Peterson and committee members. Thank you for taking the time to hear this bill today. Today I'm accompanied by Chief Rich Harvey of Lyon County and Todd Inglesby of the PFFN. In the interest of time, we'll be as brief as possible. AB 358 seeks to correct some long-standing issues within the EMS community. A white paper published in 2016 on the state of EMS challenges, EMS challenges and opportunities within the state of Nevada documented many issues at state EMS, including poor communication and responsiveness, a lack of leadership and direction, cumbersome processes for certifications, licensing, permits, course approvals, and inconsistent or unqualified opinions. The solutions recommended withered over time and were never implemented or put into policy. These unaddressed issues have negatively impacted our state EMS system, which is supposed to provide prompt, efficient, and appropriate emergency medical care and transportation to the people of Nevada. AB 358 brings these long-sought changes to state EMS, changes that will improve delivery of emergency medical services in Nevada and better align state EMS with the state's EMS providers. AB 358 has the support of the vast majority of the EMS providers and community who see it as a strong first step in improving emergency medical care in Nevada. At this point, I'm going to turn it over to my friend here, Chief Rich Harvey.
Thank you, Ken, Madam Chair, and members of the committee. I'm, for the record, Rich Harvey. I'm the second Vice President and the Government Affairs Representative for the Nevada Fire Chiefs Association and the Northern Nevada Fire Chiefs Association. Our membership is the fire departments and districts, many of them volunteers serving Nevada and Nevadans. And while fire is prominent in our name and our mission, our members are also the largest providers of emergency medical services in Nevada. responding to the 911 calls of approximately 85% of all Nevadans. The Nevada Fire Chiefs Association strongly supports AB 358. Creating the Bureau of Emergency Medical Services in the Department of Public Safety better aligns state EMS with the state EMS providers. Currently, state EMS is a program under the Division of Public and Behavioral Health. Moving state EMS into the Department of Public Safety as a bureau will be an upgrade in standing and focus attention that can be used to effect a positive change in state EMS and improve the delivery of emergency medical services to all Nevadans. The bill moves the funding and the staff that currently exists as state EMS. No new funding or fees are proposed. The white paper on state EMS challenges and opportunities within the state of Nevada that Ken referenced was published by the Northern Nevada Fire Chiefs Association in 2016 and identified many issues at state EMS, including poor communication, responsiveness, lack of leadership and direction, cumbersome processes, course approvals, inconsistent and unqualified opinions. The white paper concluded that the providers and stakeholders are not supported and an efficient system is not promoted by state EMS. The state EMS licensing certification system, for example, is cumbersome, onerous, far from transparent, and in no way timely. It can also be redundant, such as requiring a background check, a very time-consuming and not free process for an initial license application for a firefighter paramedic who just completed a background check prior to being hired by the agency directly responsible for their conduct. Just last month, state EMS issued an extension letter in lieu of renewed credentials because they needed more time to review and process applications. Delays like this jeopardize our ability to provide service by filling positions and put additional strain on our first responders and add liability to our providers. The state EMS course approval process for continuing education credits, the CEUs, necessary to meet renewal requirements and keep pace with evolving technology and medical advancements is also slow and inefficient, and with many classes being taught before the CEUs can be approved by state EMS, thus requiring additional training at a cost of both time and money to meet the required number of CEUs for renewals. Often, we have paramedic-level CEU courses waiting on approval from an EMT. With state EMS, we struggle to get timely approval for courses, even required annual courses like ITLS, International Trauma Life Support, Pediatric Life Support, and Advanced Life Support, necessary for those CEUs and recertifications. It should not be difficult for state-certified instructors teaching nationally recognized courses to get approved. There are opinions that EMS should not be based in fire departments and districts. That is simply not the current reality in Nevada or the nation. Reno Fire, Truckee Meadows Fire, Sparks Fire, sitting behind me, are all adding paramedics and ambulances in Washoe County. Counties like Lyon, Douglas, Story, and Carson City, also here today, are expanding their fire-based EMS providers in response to increasing populations and growth. The United States Fire Administration incorporated EMS in 2012. The state of Utah recently, last month in fact, passed Senate Bill 64, which moved the state EMS from health department to public safety. Fire-based EMS, the largest providers of pre-hospital care in Nevada, also need the support of state EMS to carry out the obligations to the public we serve. As I said, the largest providers of EMS in Nevada are not represented on the Advisory Committee on Emergency Medical Services. We have no voice. The Volunteer Firefighting Agency representative on the committee is from Lovelock. The Combination Fire Department representative is from Ely. The Urban Firefighting Agency representative is from the city of Elko. The private ambulance provider is from Fallon, and the Health Division employee is also from Elko. Nobody from Washoe, Carson, Douglas, Story, Carson County are on that committee. We have tried working with state EMS and the Department of Health and Human Services to make improvements since the white paper of 2016. Most recently, in 2021, a Nevada Fire Chiefs Working Group on EMS focused, along with the Department of Health and Human Services and others, on issues with state EMS. It fell apart when, in the words of the organizer from Nevada Fire Chiefs, the door was slammed in our faces. We turned our attentions towards the solutions, which eventually became Assembly Bill 358. AB 358 is the accumulation of years of effort by the Nevada Fire Chiefs Association to effect a positive change in state EMS and improve the delivery of emergency medical services in Nevada. It has been vetted at many levels and in front of many audiences. It has near unanimous support from first responders and the agencies that support them. It is also not perfect, but it still represents a major step in the right direction. Critical elements of an EMS system that provide prompt, efficient, and appropriate emergency medical care and ambulance transportation for the people of Nevada are missing, slow, or neglected. AB 358 improves the responsiveness of the state EMS to the needs of the providers and utilizers of the system. It ensures timely communication and responsiveness regarding certifications, licensing, permits, and course approvals. AB 358 represents over a decade of work invested in improving the delivery of emergency medical services in our community. EMS in Nevada is growing, changing, and maturing in its delivery to the public. Our regulatory system must mature along with it. We cannot tolerate anything less than a responsible, collaborative, cooperative, and professional environment whereby the entire system benefits and regulators and stakeholders are finally on the same team rather than opposition to one another. AB 358 recognizes that the State Fire Marshal has a proven track record working with the State Board of Fire Services, a system in place for credentialing firefighters that is mostly smooth and very transparent, and a training course approval process that is fairly easy and straightforward, whether it's a local course, regional, like the Capital City Regional Fire Academy, or statewide, like Fire Shows West or the Nevada State Firefighters Conference. Approvals, the training itself, and the certifications flow smoothly. One would expect that one system could learn and benefit from the other. AB 358 puts Nevada on the path to achieving the mission of state EMS, to promote and support an EMS system that provides prompt, efficient, and appropriate emergency medical care, ambulance transportation, and air ambulance transport for the people of Nevada. We would like to thank the chair and the committee for their time and consideration today. Before I take questions, I'd like to turn it over to Todd Inglesby and from PFFN and Dennis Nolan from TMCC. Then questions.
Good afternoon, Madam Chair, committee members. Todd Inglesby, President of Professional Firefighters Nevada. I'll make it simple, ditto to what Chief Harvey has said, but I just want to make sure everybody understands the correlation. Without us being able to get our medics certification, their continuing education credits, all that does is take members of our already short staffing off the streets to be able to protect all the citizens and the constituents that you represent. Because that's what we're talking about here. Without having a more streamlined process, it's just hurting our citizens and our ability to protect those citizens that we're sworn in to serve. Thank you.
Thank you. We had one more presenter. Okay.
Good afternoon, Madam Chair and committee members. For the record, I'm Dennis Nolan. I'm the clinical coordinator for Truckee Meadow Community College EMS and Fire program. I'm here today to testify in favor of the passage of AB 358. I emailed each of you a letter with my comments on the need for the overall bill. However, today I will be testifying for the sake of brevity and with direction from Truckee Meadows Community College, specifically on Section 22, page 23 of the bill, which greatly impacts the state's colleges, EMS programs, and our students and our emergency responder partners. Currently, state EMS program requires all EMT students to submit for a provisional ambulance attendance license to complete a one-time 10-hour ride-along observation with the fire department or ambulance services. The licensing is similar, if not identical, to the process the state requires for EMS professionals who are nationally certified and are seeking employment with those same emergency agencies. The process is time-consuming for the students filling out their online applications, time-consuming for the staff at the colleges to administer this process, time-consuming for the emergency agencies who are allowing the ride-alongs to the students, if they have to go through the system to affirm that they have been granted a license by the state. And the process adds additional unnecessary work to an already overworked and understaffed state EMS agency. Depending on workloads and staffing shortages, it's not unusual for the state to not be able to provide approved course numbers needed to fill out the application, or of approvals granted provisional licenses in time for the schools or the EMS or fire department agencies to accommodate the ride-alongs. There's no statutory or regulatory requirement for the students to go through this licensing process. And in fact, Clark County EMS Division, operating under the same state laws, does not require this type of provisional licensing. So you might ask, why don't we just direct them not to do this? The program itself defends the need to end this process in what I estimate to be approximately 500 provisional licenses each year. There would be nothing short of prohibitive legislation to prevent this particular administration or any new administrator in the future from reinstituting this process if legislation wasn't passed to prohibit it. And while this probationary license will become a regular license for some student who goes on to be employed, let that happen when that individual applies and is hired by our department. Very recently, the EMS program had eliminated one step in this process of provisional licensure, which has made it less onerous. However, making an unnecessary exercise in futility less onerous is really tantamount to putting lipstick on, you pick your favorite bovine. Thank you very much, and I'm be glad to answer any questions.
Thank you. We do have several questions, so I appreciate folks sticking around for those. I'm going to start with Assemblywoman Newby, and we'll go from there.
Thank you, Madam Chairwoman, and thank you for the bill presentation. My question is, what do these delays do at the ground level? What are the operational impacts that you're seeing as a result?
Madam Chair, and through you to this.
You can go directly. Thank you.
Madam Assemblywoman, I think there's two major impacts. The first is filling positions, right? To hire somebody into a paramedic position, they have to have a paramedic license. And any delay in getting that license means a delay in getting that position filled. And so that's either A, nobody is available to fill that slot, or B, the people that are already working are getting mandatoried and covering overtime shifts and working longer and longer hours in order to provide the coverage for the position that is missing. So it's kind of a twofold thing, getting them into the system and having more stress on the system when we don't have all the bodies in it.
Ken Gray for the record, Assemblyman Newby. Having been an EMS myself and actually having to work with court certification stuff, one of the big problems I see also is getting the latest and greatest material to the students. You know, if there's a change in a protocol or something, you can't teach that until it's approved. You still have to go by the old protocols or, whatever the old curriculum is. So it is very imperative that that curriculum gets approved as soon as possible.
And Assemblywoman Newby, from the college perspective, the delay in the provisional licensing and the course numbers ultimately results in us either having to delay course startups. I'm sorry, for the record, Dennis Nolan. And the other part of the provisional process is that we schedule with all the regional fire departments ride-along opportunities for each of the students. And on more than one occasion, not receiving their provisionals has had us have to cancel those, which is not only a problem for us and an inconvenience for the student, but also for the fire departments and EMS agencies who've blocked time and space for these people to come in and ride along.
Thank you, Assemblywoman Thomas.
Thank you, Madam Chair, and thank you for the presentation. Do appreciate it. But I'm trying to understand this bill. So you started off saying that you wanted more committee members to be on or have a committee. How did you put it? You don't have a seat at the table. So more people on the committee. The other thing was appointments for the practicum, and then your licensing and coursework. So what else?
Madam Assemblywoman, that's a great question.
Would you state your name for the record?
Rich
Thank you.
Harvey, Nevada Fire Chiefs Association. So let me start with the one, the representation. The committee size basically stays the same. State EMS committee still is the state EMS committee. It just moves from being under the Department of Behavioral Health and Human Services over to the Department of Public Safety under the State Fire Marshal. The makeup of that committee is currently appointed by DHSS. It will eventually be appointed by the Department of Public Safety. That's where we'll address some of that membership on the committee so that the members of the committee are actually representing the providers of the service. I mean, for example, right now, the urban firefighting representative is from the city of Elko, population of 22. I just confirmed by text they run 4 or 5 calls a month, transports, EMS transports. So by comparison, the city of Reno or Truckee Meadows or somebody in Washoe County is running 10, 100 times that call volume. And that's why we want the representation on the committee to ultimately reflect the people that are providing that service, right? So that we have representation there. The credentialing issue is sort of separate. The committee helps oversee, or state EMS runs the credentialing procedure. Talked to Clark County the other day. In Clark County, you can walk in to their county EMS office and walk out with your license in the same day. Just the other day, state EMS put out an email to all the providers in the other 16 counties that says, bear with us, it's going to be a while, we're pretty far behind. So we want to find a way to improve the speed of delivery of credentialing, right? That licenses get applied a lot quicker. One of the reasons we have confidence in the State Fire Marshal's office is they already credential firefighters. So the firefighters get their certification from the State Fire Marshal's office in a timely manner. We're hopeful that by merging what's best from state EMS with what's best from DPS, that we get a system that works better for everybody involved. That's kind of the correlation there. Same with course approvals. You know, the course approval going through the State Fire Marshal's office, they approve courses and instructors, works pretty smooth. State EMS has delays. Those delays hurt us. So again, we're hopeful that the two systems existing under the same leadership provide a better way of speeding it up. Not a loss in quality. No changes there. We're not trying to do that. We're just trying to make it more efficient. I'll give you a quick example. Central Lyon County Fire has 9 people that we just hired as firefighter paramedics. They're going through the fire academy and they're working on getting their licenses. Our battalion chiefs just sent them a letter the other day, or an email, telling them to be patient. The portal to get your license is really quick. Last Friday, they finished the hazmat part of the fire academy, and by Monday, they had their credentials from the State Fire Marshal's office. Those are the kind of efficiencies that we're looking to create. Better way of doing business. And if there was a second part of your question, I forgot it.
Yes, please go ahead. And I do want to make note that it is Friday before a deadline week, and I think folks are looking forward to getting home to their families and have some plane flights out of here. Not to rush this, but just if we could keep our answers succinct, it would be great.
Copy.
Well, I appreciate the concise answer because the bill was confusing. All right, so I appreciate it. Thank you.
All right, we have Assemblywoman Taylor next. Please go ahead.
Thank you, Madam Chair. And this should be a concise one. I'm wondering what does state EMS think about this change? I can probably guess, but
Well, Madam Assemblywoman Taylor, for the record, Rich Harvey, Nevada Fire Chiefs Association. I've asked him that. I sent him an email before we even developed the BDR to sit down and talk about it. Got no response. So I imagine they will be testifying at some point in time. I don't know their actual opinion.
Okay. I appreciate that, Chief. Thank you. Thank you, Chair.
Thank you, both of you. We have Assemblyman Koenig next.
Thank you, Chair. So my question kind of dovetails what was previously asked. So I want to know a little bit more of the makeup of that board that has one from Fallon, one from Lovelock, two from Elko, one from Ely. I mean, yay, Fallon's represented, but how do those people get appointed? I mean, that's kind of just from the outside looking in, that's kind of a skewed representation. How does those people get appointed, and what would be the appointing process of this new board or new bureau that you're creating, and how do we maybe make sure that there's a little better representation than, I mean, is there going to have one from here, one from here, one from here to make sure that we have a better representation? I mean, to have two from Elko and none from anywhere this side of the state doesn't make sense. So I was just wondering how that makeup works.
So if I may, Assemblyman, good question. Dennis Nolan with Truckee Meadows Community College. I'm answering this question because I most recently had served on that same committee. I retired from the Reno Fire Department last year as their EMS division chief, and in that capacity had served on the State EMS Advisory Committee. So, and that's the official name of it. It is a voluntary advisory committee that's made up of a number of professionals which are prescribed in NRS that cover, for most part, most of the spectrum of the emergency medical service providers. And Chief Harvey here will kind of enumerate that in just a minute. But when there's a vacancy in the committee, and again, let me digress for just a minute. This is a advisory committee, so all they really can provide to the state EMS office is voluntary direction and advisement. The state does not have to, EMS, and quite often does not accept that. Suggestions, directions, advice from this professional advisory committee. So again, when there's an opening in the committee, the chairman of that committee, who's elected for a 2-year term, will direct the committee and the state to seek out individuals who might be interested in the committee, individuals who are interested in serving on one specified position will submit their name and a CV, and then are considered by that committee.
Assemblyman, for the record, Rich Harvey, Nevada Fire Chiefs. There is a published list of who's on that committee and the positions that they fill. I would say the answer to your question of how it becomes so rural, for lack of a better term, is up to how the committee does its work, which nominates individuals and then they're approved up the chain of command. That process will not change. But when you go down who is appointed, for example, a registered nurse who has experience providing emergency medical service, that person is from the Department of Air Force in Las Vegas, Nevada. Okay, Las Vegas, Nevada is in Clark County last I checked, and they don't even have anything to do with the state EMS system. They're not affected by it, for example, right? And so over time, somehow this membership has grown to not be reflective of the providers of state EMS in the rest of the state. We're hopeful that with the board or the committee supported, that their recommendations carry weight, that the people appointed as these expire will better reflect the diversity of the providers of EMS in Nevada.
Quick follow-up, Chair. Could you potentially set it up as this will consist of one member from Washoe County, one from Carson County, one from, I mean, just however you want to do that, so that you never end up with two from Elko and none from Carson or Lyon. Can you specify where those people come from ahead of time when you're forming this?
Assemblyman Rich Harvey, for the record. That is a possibility. The way we set it up was to more clearly define a volunteer-based fire EMS provider, a midterm combination department provider, and an urban provider. We can certainly examine it. I think everybody has the same goal in terms of making the committee diverse enough to represent all the providers of EMS in the 16 counties that are not Clark in Nevada, and that's what we want to try to do.
Thank you.
Thank you for the questions. I have significant concerns with any entity that requires you volunteer, because we know that purse strings are tightening for everybody, and it makes people less and less likely to be willing to serve on these committees and or commissions. And I do wonder sometimes if part of the reason we're not seeing the right representation is because we don't compensate people for their time and expertise on these issue areas. I understand the desire for it to be volunteer, but we're in a different world today than we were 10, 20 years ago. So I was looking through, it looks like there is an in section 16 an existing per diem and travel specification in here. So there is some recovery of those dollars. It's not all just volunteer and self-paid. So are there other questions from the committee? Seeing none, we'll go ahead and move into, Assemblyman.
I just wanted to say something real quick. Well, first of all, we're not a money committee, ma'am. We can't. I'm kidding. You know, as you hear some of the opposition, you may hear, that, hey, it works great for us, but we got to remember it's not working great for the other 85% of the providers. So that's, we're looking to fix things. You also might hear that, things are changing. And into that, I'm sorry, I've got to say, too little, too late. I mean, 7 years since the paper was published is quite a long time to begin to initiate changes. But anyways, thank you for your time today, and that's all I've got.
You'll have another opportunity at the end if you want to waive those remarks. We'll start with support testimony here in Carson City and in Las Vegas. If there are folks who'd like to present support testimony. And again, we appreciate everyone's input and stories. If we could not duplicate and instead ditto some statements, that would be appreciated for time. Please remember to state your name for the record, and you may begin when you're ready.
Thank you, Madam Chair. Dave Cochran, Reno Fire Chief. I'm also the president of the Nevada Fire Chiefs Association. And in honor of your request that we be succinct, I will not repeat the comments of Mr. Inglesby, Chief Inglesby, and Chief Harvey, but I would echo those and offer support on behalf of the City of Reno, Reno Fire Department, and the Nevada Fire Chiefs Association. Thank you.
Y'all, that is how you do a support testimony. Thank you so much. Please go ahead.
Thank you, Madam Chair. My name is Charles Moore. I'm Fire Chief for Truckee Meadows Fire. We serve a large portion of Washoe County. Serve about 105,000 constituents. We run about 10,000 EMS calls a day providing ALS service. 2 points I want to make. There are glaring problems with the current arrangement. Accountability, efficiency, and oversight. I could give you many anecdotes. I'm going to give you one. We hired 2 paramedics 2 years ago and found out just last week that they were never certified as ambulance attendants, even though their paperwork was efficiently submitted by us. And unbeknownst to us, when they went to renew, sorry, we lost your paperwork. I could go on for weeks telling you problems like that, and that simply needs to be fixed. I think another major issue that I have is that pre-hospital care and emergency response is more of a public safety function than it is a public health function. 12 weeks ago, you heard a very famous member of our community was run over by a snowplow and nearly killed. Through our response and through North Lake Tahoe and REMSA Care Flight, that life was saved. On Monday, I was assisting a motorist on 580. I was hit by a car at 45 miles an hour. And I was pushed into a concrete barrier Luckily, my radio was not knocked out of my hand, and I was able to call for help. I would equate these problems to, sorry, Chief, we can't find the keys to the ambulance and come and help you. I mean, they're glaring and they need to be fixed, and I think that EMS and emergency response is better placed under the Department of Public Safety rather than the Department of Public Health. So thank you so much.
Thank you. I do hear that our community member is part titanium now, which I think just adds to the narrative of superheroisms. And thank you for your service. I'm been on those roads myself doing inspections, and it is terrifying out there. And as a PSA from this position, I just ask people to please be respectful on the roads of people who are pulled off to the sides. It is incredibly dangerous out there. Please remember to state your name for the record. You may begin when you're ready.
Good afternoon, Madam Chair, members of the Assembly. Ryan McIntosh, Assistant Fire Chief for Central Lyon County Fire for the record. I'm the Operations Chief for the largest and busiest fire protection district in Lyon County, which happens to be the third largest county in Nevada. We run all of our EMS certification, CUs, everything through state EMS. When I took my position 4 years ago, one of the problems we had was trying to get our providers licensed in a timely manner. An opening came up to represent the combination fire protection or combination fire departments on the state EMS advisory board. I was like, great place for me to be involved, to try to make some change, to help my providers be able to serve our constituency. Threw my name in the hat, wrote a nice letter, attended all the meetings, made sure I was up to speed. Day of the nominations came, the board nominated each other, not following the state law. The current position holder for the position I was running for on the board was from Ely. His friend and Fallon nominated him, he nominated him, they nominated each other, and it got pushed through. The Department of Health and Human Services is supposed to make those elections. The board elected themselves. So me being very disappointed that I wasn't able to take the opportunity to make the change I saw fit, I wrote the former Director of Health and Human Services an email, asked for a DAG opinion on how the nominations and elections were carried out. About 6 months later, I heard nothing. Wrote an email back, asked if I could get some follow-up. I got a 2-sentence email that said, DAG opinion says Health and Human Services can take the recommendations of the advisory board, and they've been reappointed to their positions. Very contrary, the entire procedure for how the state law says that advisory board should be filled. Obviously left me in a position of disappointment because I was hoping to make positive change on the advisory board, and created my feelings towards state EMS and that advisory board is a position of being very disenfranchised. And an example of some of the inefficiencies in state EMS currently, I hired a gentleman out of the state of California back in October as a single role paramedic for Central Lyon County Fire. Licensed paramedic, working for a very busy system in Vallejo, California. He came over to Nevada to come work for us. He submitted his application in October. It was never even recognized till almost March. And then I got an email saying, you fill out the wrong application, do not practice in the state of Nevada, you are not qualified. He's a National Registry paramedic, former California certified paramedic. State EMS office told him not to practice in Nevada because he filled out the wrong application, gave him no notification for over 4 months. I, at that point, needing this paramedic to provide service to our constituency, picked up the phone, called the representative at State EMS and said, hey, what's the hang up? What can we do to fix it? I'll spend my entire day trying to get this license fixed. I got a roundabout, and by the end of the conversation, I was told the State EMS office has a very limited amount of people. They're doing the best they can, but that is the expectation we should get on the end of the line as the providers in Nevada, in northern Nevada, outside of Clark County, for the inefficiencies of state EMS. 4 months of no response is the best they can do. So, thank you for hearing my testimony. I'm for the passage of 358. Believe it can make great changes for the providers of EMS in the state of Nevada. Thank you.
Thank you for your testimony. Please remember to state your name. Go ahead.
Thanks. Michael Schultz, the Director of Public Safety Programs at Truckee Meadows Community College. I'm here in support of the passage of this bill, and I would just like to add a couple things to what's already been said in regards to the provisional licensing. There's really zero need for it. All it does is it keeps our students from moving forward in their programs. For instance, if a student finishes up their didactic portion and are heading into the clinical field, if we don't have those yet, they're stalled. They're pretty much hedged up from moving forward. Secondly, just to reiterate what has been said briefly, is that there are departments that are running at half capacity. There's agencies that are struggling to get folks into the state to be able to become providers in the state. Our Truckee Meadows Community College is running at any given moment 5 paramedic programs between our hybrid programs and our in-class programs. And quite frankly, we can continue to do that for the next 5 years, and we won't really even put a dent in the need for what we have here in Northern Nevada. And so anything that we can do to ease up the burden on licensing would be really appreciated, and that is all I have. Thank you.
Thank you for your testimony. Seeing no one else coming up to the desk in Carson City, we go to Las Vegas. Is there anyone in Las Vegas in support of Assembly Bill 358? Seeing none, BPS, would you check the public line for support testimony on Assembly Bill 358?
To testify in support of Assembly Bill 358, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in support at this time.
Thank you. We'll go ahead and move into opposition testimony. If there are folks in Carson City or Las Vegas who'd like to provide opposition testimony, we'd invite you to the table. Please remember to state your name for the record. You may begin when you're ready.
Good afternoon, Chair Peters and members of the committee. Lindsay Knox with McDonald Carano here representing REMSA. Our responsibility is to provide the best possible care, which requires us to have a strong relationship with the other health care providers and health agencies. We do not believe moving EMS under the state fire marshal will enhance the level of care to our patients. The future of EMS must remain aligned with health care rather than public safety. This was very visible during the pandemic and remains visible with EMS moving into areas like telehealth and behavioral health. We strongly oppose AB 358.
Good afternoon. My name is Chris McCann. I'm the EMS chief for Elko County. The state of Nevada, like 42 other states, has the state EMS office aligned with the state health division. That's because the EMS naturally contributes to the vision of the Department of Public and Behavioral Health, which is to protect, promote, and improve the physical and behavioral health and safety of all in Nevada. EMS is emergency medical services. Or today, it is viewed more as a medical services that are done outside of a healthcare facility. Across Nevada, that looks different, from our rural volunteer services to metro services that provide mobile integrated healthcare and nurse triage lines. During the COVID pandemic, Elko County Ambulance played a critical role in the healthcare emergency response. As we did things like running a MAB clinic, which is monoclonal antibodies, or public testing, we asked many questions of the state EMS office to make sure we were in compliance. Those answers were streamlined because of their position within the Division of Public and Behavioral Health. Only 27% of the agencies that are permitted by the state EMS office are fire-based agencies. The other 73% of non-fire agencies consist of air ambulances, private and municipal ambulances, and other grand transport agencies. Many of these agencies transport after a fire department corresponds with them. Elko County is one of those. The state EMS office is working with minimal funding and extremely low staffing. During the testimony, you heard that there's multiple problems with getting applications returned. With a staff of 4 that's processing 8,000 plus applications each year, I can imagine that is difficult. This bill does nothing to address these problems. It only moves EMS away from healthcare. I believe we all agree that the EMS office needs change. They need to be properly funded, and they should be a division or a bureau within Health and Human Services. The EMS office needs staffed, as suggested by the 2016 white paper, which has already been mentioned, or the 2009 National Highway Traffic and Safety Administration study on EMS in Nevada also made suggestions for more staffing in the state. Since that study, we have gone from 8 FTEs in the office to 7. And they're not even able to fill those positions because of the funding. I would also address for a moment the Committee on EMS. I know that this committee here has addressed AB 24 to make some changes to that. It was only a few years ago that the rurals were talking about how we didn't have representation. It's interesting how that shift has occurred, and I think that's largely because those meetings are now virtual. I express my opposition to this bill, and thank you.
Thank you, Madam Chair. Members of the committee, my name is Tom Clark. I'm here on behalf of MedX Air 1. MedX Air 1 is the rural air and ground transportation system out of Elko, and I, in deference of time, will simply say me too to the previous testimony. Thank you, Madam Chair.
Thank you, appreciate it. We see someone in Las Vegas. Please remember to state your name for the record. You may begin.
Madam Chairman, my name is Brian McAnellen, and I represent GMR Global Medical Response. I'd like to associate myself with the comments that were made in opposition to this legislation. Our big concern is that EMS should stay with healthcare and not be part of the Fire Marshal's division. We realize that currently EMS, there's a number of challenges. We ought to address the provisional license issue. We need to address the credentialing and reciprocity challenges, and we should keep that going in EMS right now. They are understaffed. They do need help. This bill will not resolve those issues. We should put our resources towards fortifying the EMS system and offices right now. This bill does create a chief of EMS. That's a good part of the bill. We should keep that in there, but we should keep that in its current structure. Thank you.
Thank you for your testimony. Is there anyone else in Las Vegas who would like to provide opposition testimony? Seeing none, BPS, would you check the public line for opposition testimony on Assembly Bill 358?
To testify in opposition to Assembly Bill 358, please press star 9 now to take your place in the queue.
Good afternoon, Madam Chair and Committee. My name is Damon Schilling, and I have the honor of serving as the current president of the Nevada Ambulance Association. This association represents emergency and non-emergency private ambulance services in the state and makes up the largest ground and air ambulance association in the state as well. This association submitted a letter as we wanted to be assured of this testimony. The Nevada Ambulance Association strongly opposes AB 358. More than ever, emergency medical services has aligned with public health care, and that was evident during the national pandemic. The Center of Medicare and Medicaid Services, known as CMS, has aligned EMS with healthcare to provide better care, improve health of populations, and do it at a lower cost. EMS in Nevada has initiated mobile integrated health for in-home visits, transportation to alternative destinations such as urgent cares and behavioral health centers, and even in-home health telehealth with qualified healthcare providers to provide in-hospital bed capacities to improve those and to decrease emergency department overcrowding. Working with our healthcare facility partners will mold the future of EMS to provide the right care at the right time at the right cost. We do not believe that moving EMS under the State Fire Marshal and Public Safety as outlined in AB 358 will improve the delivery of emergency medical services or pre-hospital health care within the state of Nevada. We are aware of some of the licensure issues that exist, and thus we would recommend creating the Bureau of EMS or Emergency Medical Services and a Bureau Chief of EMS to oversee the agency under the Department of Health and Human Services. This may improve processes and areas of concern expressed by those who do support this bill. Thank you for allowing the Nevada Ambulance Association to provide testimony in opposition of AB 358.
Thank you for your testimony. Next caller, please.
Chair, there are no other callers to testify in opposition at this time.
Thank you. We'll go ahead into neutral testimony. Is there anyone in Carson City or Las Vegas who would like to provide neutral testimony on Assembly Bill 358? Hello, welcome. Please remember to state your name for the record. You may begin.
Good afternoon, Madam Chair, members of the committee. My name is Mike Dzyak, D-Z-Y-A-K, and I am your state fire marshal. This was not something that the fire marshal or the Department of Public Safety sought out. This was some problems that were brought to us and asked if we could help. In looking at the issues we've heard today and within state EMS, I just wanted to say to the members of the committee that regardless of your decision, we already do a lot of the similar things. I answer to the Board of Fire Services, Nevada Board of Fire Services. They meet quarterly. They tell us what we should be doing, what we need to do more of. We listen to them, and we provide the services that apparently they're happy with. We perform inspections. The certification of all the firefighters, I have a staff of 4 FTEs and 1 contractor that certify all the state firefighters within the state. We also accept reciprocal certifications from out of state through IFSAC. I think it's the International Fire Services Accreditation College, but that's a mouthful. So we do a lot of the similar things. So if this is the will of the legislature and you want to put it over there, you have my commitment to doing everything within my power to fix it, and it is not some sort of issue on our side where we're looking to get into some of the testimony you heard here today, their concerns. And I'm here for any questions if you have them.
I'm glad you offered that because I did have a question. I'm glad you're here today. I was wondering about, you mentioned that you do some work with another board, but it sounds like it might be the opposite direction, right? Where the board is above you and helps direct your efforts. And with this, my understanding, and maybe I would need to reread it and reread some of the testimony, but is that it would be backwards, right? So you would be appointing folks to this committee or helping them as a committee. So can you talk a little bit about your experience and the way with another board or committee that works similar to how this is proposed to work under your office?
Yes, thank you for the question, Madam Chair. Again, Mike Dzyak for the record. The Nevada Board of Fire Services is comprised of fire officials from throughout the state, and that board is an advisory board to me. We have the chief of a paid department, chief of a partial paid department, training officer of a volunteer or a partial paid or volunteer. So it's structured in a much similar way, which is why I think the bill is structured the way it is. Since being appointed as the state fire marshal, I make sure we hold quarterly meetings. Once we got through the COVID issues, it has its own budget for travel to make sure we get everybody here. We do it online. So it's very similar to what they're saying. As far as the governor appoints to the Board of Fire Services, I understand. I'm listening to what these issues are, and there's a lot of similarities in what we had to go through to get where we're at. And a state agency that's not listening to the board appointed to it to advise them, it's no different than hiring an attorney and not listening to their advice, not taking their advice to the best of your ability, or coming with a reasonable measure to say we can't do this because, and how having the board help to solve your issues. That answer your question?
It helps paint the picture. Are there any other questions for our state fire marshal? Are all of our fire stuff, is it all certified? I don't know if other people have had this happen. We have like our fire extinguishers all certified regularly. Have you done that to this building recently?
And Madam Chair, for the record, Mike Dzyak, those had better be done recently, or there will be answered questions very shortly. But yes, I'm pretty sure. I would bet high.
I would imagine, but I haven't checked myself, so I thought I'd just see where we are in compliance with your office. Thank you for being here today. We're going to go to Las Vegas for neutral testimony. Please go ahead.
Yes, ma'am, Madam Chair, members of the committee. My name is Kelly Quinn. As a former provider of EMS and also a former regulator of with the EMS section that you're talking about, it's been many years ago. I continue my public service as a peace officer of the state of Nevada. But as I read through this bill and listen to some of the testimony, I hear a lot of the problems that's happening within the EMS section and the desire to move it to public safety. And there was a bill many years ago that tried doing the same thing, and it failed during that time because it was viewed as the fire departments wanting to pull themselves out from under the regulatory authority of the boards of health and out of the EMS section. So I'm curious on this, if all the staff and the programming moves to public safety and the fire marshal, what's going to change? It's all going to be the same people, the same programming, just another level of bureaucracy. And also, as I'm listening to it, what's been done to help the EMS section? I heard it was 7 years ago there's a white paper presented. And has there been efforts made to support the EMS section to get their jobs done? I actually did have some conversation with one of the offices. Wasn't able to contact Clark County on this particular bill, but staffing shortages across the board in the state, including my current department, there's staffing shortages throughout. And the EMS section, I heard that the FTEs that we have right now, that is far less than even when I worked for the section years ago. I think they need the support. They need the positions, certainly. And I agree that it shouldn't take weeks or even months to process certain paperwork. So I think that needs to be looked into to find out how to make that more efficient. Now, if the fire marshal's office is going to be more efficient and have the systems in place, then I would support that. But I think that if we look at how the EMS section is supported now, that would be a great improvement. And with my final comment is the section staff aren't here today either. I would encourage them to get to the table, or perhaps the committee members reaching out to those staff as well and find out what their needs are and supporting them the best you can. Thank you.
Thank you for your testimony. We have some guardrails around support, opposition, and neutral testimony. And because of the specifics called out in that testimony, I would reclassify that as opposition, but only to the definition that we generally use in our committee. Is there anyone else in Las Vegas to provide neutral testimony? Seeing none, BPS, is there anyone on the public line who'd like to provide neutral testimony?
To testify in neutral for Assembly Bill 358, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in neutral at this time.
Thank you, bill sponsor. I see we didn't waive our final closing remarks. Please go ahead.
Just trying to get through this as quick as possible, so I didn't wait for the invite. You heard some folks testify, and one thing that drew my attention, you might want to notice, is they were private industry. They've got their place, but fire EMS in this state, they provide 85% of the calls. We should drive our policy to support them and what they're asking for, and they have come to the table and asked for the support so they can be the guys that show up at our door that are licensed, trained, and ready to go. Nothing's going to stop the, as we call it, curbside medicine. During COVID, these guys showed up and helped out, with folks at homes and stuff like that without necessarily having to transport them. That arena is not going to change. They're still going to provide those services, and there still will be a medical director over it. But it's a sound policy decision. Thank you, Madam Chair, and I am really encouraging you guys to move this to a work session quickly.
Thank you. All right. Well, we'll go ahead and close the hearing on Assembly Bill 358, which takes us to the end of our hearings today, which leaves public comment as our last agenda item. I will go ahead and open public comment. We are offering public comment for 2 minutes, limited to 2 minutes, to make sure we can get to all folks in a fair manner. We will start here in Carson City. If there's anyone who'd like to provide public comment in Carson City, I invite you to the table. Seeing none, is there anyone in Las Vegas who'd like to provide public comment today? Seeing none. BPS, is there anyone on the public line who'd like to provide public comment today?
If you would like to provide public comment, please press star 9 now to take your place in the queue.
Good afternoon, Madam Chair, Peters, and the committee. My name is Dora Martinez, and I represent the Nevada Disability Action Coalition. Madam Peters, I was trying to call in earlier to testify in support for Assemblywoman Torres, and I just now was able to find the number. Can I please make my support statement, please?
Yes, I think we can make a note to put this in the support testimony for Assembly Bill 348. Please go ahead.
Yes. Thank you so very much for your accommodation, Madam Chair. So, like I said, I am Dora Martinez. I really support the Assembly Bill 348. Hearing the opposition, while that may be true, but this bill would help the foster children and children who are in the rural area. And like what she said, as a grandma of a new foster child that we took in who have disability, this is going to come in place because I don't have a car. I mean, there's a car in our parking lot, but it's not mine. It's my son's, and he has school, so he goes and lives his life. And I depend on the bus to take me, bring them to school, and when that doesn't work, this would play into that. So while some people say that they didn't get to talk to them or whatever, we are living in that moment that Assemblywoman Torres is talking about. We are the one who are in the Washoe County area, but it feels like we are in the rural area because we are having a hard time finding assistance. And my foster, I'll just call her grandchild because she is my grandchild, is under 5. So thank you so much for everything you do, and have a great weekend. Stay safe.
Thank you for your testimony. BPS, is there anyone else on the public line for public testimony today or public comment today?
Chair, there are no other callers choosing to provide public comment at this time.
Thank you. Well, that wraps us up for today. We're going to close public comment, and I'm just going to note we will meet on Monday, I think at our regular time, but keep an eye on that agenda. Please make sure your attachés are checking that agenda at least Monday morning for you all. And with that, we are adjourned. Have a wonderful weekend.